Dear friends, let's continue with the topic on cancer of the cervix. We saw in the previous presentation, we saw what is cancer of the cervix, how does it present, and we saw a little bit on the epidemiology, how many people are affected, how are the countries affected. Let's see the cause, the predisposing factors of this condition. We are going to see in very few slides. We are not going to see many as well, so that we don't take it too much. When it is short, it is easily understood, and we try the best to summarize it again. So, the causes or predisposing factors of the cancer of the cervix are not many, but mainly the most uh, commonly found that we can do something about. Let's see them. As a mother, a lady who has been sexually active comes to hospital, will be examined. They put her on a gynecological examination table. Then you see, when you do your digital examination, you can see the pelvis. In the pelvis, the uterus is between the finger on top of suprapubic area above this pubic bone, and the other one is into the vagina. The uterus will be in between. So the cervix is here on the finger, and if there is any problem on the uterus, whether a mass or whatever, when it is big, it would be palpable when do examination. But before cancer reaches that stage now, before you start feeling something with your hand, your fingers, you might only have cancer on the cervix without feeling it. You might see the changes which will cause you to start suspecting it. Then the causes, because that's what we need to focus on, is mainly infections. Infections, especially with the human papilloma virus. This virus is very cruel because it is known to be the highest, the one which is causing the highest, the risk is the one to be known to be the most causing element to develop cancer of the cervix. So we have different types, but the most known one is type 16 and type 18. Type 6 and 11, they can cause also the development of this cancer, but mainly type 16 and 18. So this infection is cruel, and it is common. It is common. That's why we still have high numbers of cancers, new incidences, and the prevalence is high as well. So in short, now, when we summarize the main reason, main driving causes or predisposing factors is that HPV, human papilloma virus, which is seen in almost all cancers of the cervix, but the genetic makeup, you might be having like a genetic component from the family, environment, the chemicals, the irradiations that we are exposed to, or lifestyle. The lifestyle, if you are a man, you are a woman, you sleep around, you keep on exchanging girls, meaning you are spreading that virus. You are taking it from one lady to another. You know, if you are a lady, you are sleeping around, then it means you are giving that man to give it to another as well. So this lifestyle is a problem. It's one of the predisposing factor. If you have many sexual partners, that is a great, the greater the number you have of sexual partners, the greater chances of contracting this HPV, human papilloma virus. The other factor is early sexual activity. For young girls who are below 18 years, they are still growing. They still have soft tissue, soft cells, which are easy prone to contract these infections. So this HPV, human papilloma virus, is the one which will expose these young ladies to develop this cancer. It predisposes them to predisposition to develop this cancer. So there are other sexual transmitted infections, such as those which are due to chlamydia, gonorrhea, syphilis, or HIV. So we'll see maybe in a different chapter when we will be seeing the STIs, sexual transmitted infections. We'll see them separately. But once these infections have been damaging that cervix, and these infections can also make some modification in the functionality of those cells, and the cell will start to, the DNA will start coding wrong information, and cancer might start as well. HIV, including other immunodepressive conditions, especially when HIV is not treated. If it's not treated, it's not well controlled, then it becomes a problem because you fail to pick up the immunity. So that's the issue. But once you take your medication normally, regularly, no stress, your life will be like a normal life. You just need to keep on checking, screening. That's why we talk about weak immunity. If the immunity is low due to different conditions, cancer or for other conditions, other types, or diabetes, or have a severe malnutrition, anything that will cause your immune system to go down. So before we close, I want to add cigarette smoking. Cigarette smoking is known to be a very carcinogenic because of the toxins that are in the cigarette. The cigarette smoking do not only go to the lungs, not only in the mouth, they can still go to the cervix. So these are the, in short, few predisposing factors and causing agencies for developing this cancer. Thank you for following the presentation. We hope we got something. We are going to see the next topic where we'll be addressing signs and symptoms. When do you start saying that somebody has cancer of the cervix? Do we know the signs? Please don't miss the following topic, which is coming. It won't be too long as well. So I hope it is going to help us to understand more so that we can take right decisions. Thank you.